Welcome to Alzheimer's Sunrise, lighting the way for patients and caregivers on Legends 100.3, brought to you by Alzheimer's Community Care, providing help and hope for thousands of families for the past 20 years. Here's Mary Barnes, CEO of Alzheimer's Community Care.
This is Mary Barnes, and we're going to be entering into the world of Alzheimer's. This is the Alzheimer's Sunrise, shining a light for patients and caregivers. And who's joining us today is
Karen Gilbert, and I'm proud to serve as Vice President for Education and Quality Assurance for Alzheimer's Community Care.
And we have a special guest with us today, someone who's very dear to me, but we've known each other for a long time, Mark Shalloway of Shalloway and Shalloway, and he's what we call an elder law attorney.
Right. And a board member.
And a board member as well, a very solid, long-time board member that we value very, very much. Getting into discussion mode here, what is an elder law attorney?
You know, it's fascinating that if you ask people what an elder law attorney does, we define our work by the clients that we serve. If I were to survey other lawyers, they would say I'm a divorce lawyer, I'm a real estate lawyer, a criminal defense lawyer. We instead define ourselves by our subject matter. What happened was pretty organic. Medicine and science was advancing and people are living longer. And we needed to look at estate planning, sort of a 2.0 version rather than 1.0, because originally elder law attorneys came from two camps. The first being lawyers who traditionally drafted wills, trusts, powers of attorney. And then a second camp of those lawyers working in nonprofits, maybe like legal services plans and organizations. And what the issues became was more about not death and taxes, but what happens if we get sick and live, incapacity and impoverishment.
Interesting.
And issues that were really born out of chronic illness, whether it's Alzheimer's or related memory disorders, or sometimes it starts off to be a little more physical, like Parkinson's, and it really threw a challenge to the middle class, older adult, or family, however you define, where the problems they were facing were really diverse, many, many different areas, including understanding that there's acute medical care delivered by doctors and hospitals and nurses and therapists, and that for the older adult was really historically covered by Medicare and its various forms of health insurance. And then if we were younger and working, by our health insurance, perhaps through employment. And then we, in the 80s, realized that as people towards end of life needed care, we developed something called palliative care, or commonly hospice, and that was coverage triggered by a prognosis of 6 months or less to live, even though folks could be on the program longer if recertified. But what really was not identified in the 60s and 70s and earlier, rather, I should say, was this idea of chronic long-term care. And the idea that one needed help with dressing and bathing and feeding and toileting, what clinicians call activities of daily living. Mm-hmm. And sometimes the leading indicators were their instrumental activities of daily living, like scheduling doctor's appointments, maintaining the home. So elder law attorneys that came from these two camps had to help clients solve problems and figure out how do they address these issues. And then one of the elephants in the room was, how do you pay for unskilled custodial care to help, say, an Alzheimer's patient get dressed in the morning, who may be suffering through agnosia and not know what an object is for, scald themselves in a shower, or not be able to prepare a meal or turn off a gas stove. And you don't need a nurse or a physician for that, but you do need help. And a caregiver can get burnout, as we know, and that cost is not covered by traditional health insurance.
So is it important to get this kind of legal attention? Is there a good time to do this?
Well, it's important and urgent if you're thrust into a significant stroke, or you have a profound injury or acute illness. But with, for example, Alzheimer's disease, we know that it typically progresses over a period of time, and the earlier one becomes informed the better their options are going to be, the more options they're going to have, the more thoughtful they can be about it, the more educated they can be, rather than trying to put up, shutters in a hurricane, with the Alzheimer's, for instance, being the hurricane. I think the more effective they're going to be, in planning. So, Mary, it's interesting. It's been said you can have an issue that's important but not urgent, or you can have an issue that's urgent and important, and it
Yes.
kind of falls somewhere within those domains.
Yes.
When do we need to do it? As early on. Yeah.
So what type of tools, because I don't think there's any question that planning in advance is always better than trying to put out a fire.
Right. But what is planning?
The stitch into, exactly.
What are we planning for?
What does it
Yeah.
look like for the average relatively healthy couple in their 60s, let's say, that really have no idea what their future health will be? We don't know. We try to watch, but we can't be sure. What can this look like if you want to do some competent, rational planning while you have full capacity, maybe involving children in that planning? What would this look like if you really want to be preventive
Yeah, it's a great
in
question.
this realm?
Yeah. So what I would say is many people come to the question thinking, well, I need to do a will, and I need to make sure that my assets go, if married, say, to spouse, and then out to the children, something along those lines. And that's absolutely true. It's your legacy. It's part of what we, as a society, have always had to plan for. However, the elder law attorney addresses that, but in addition, starts a conversation saying, what happens if cognitively we are unable to manage our healthcare decision making? When does an inability to do that consistently with the capacity to make informed choices really become very, very tenuous, transient? And do we need to do advanced directives, such as designations of healthcare surrogate or healthcare proxies, as they're called, from state to state? And what about how we pay for care? And what about balancing the reality of needing, whether it's family or friends, to be a part of the planning process against privacy? And we're not operating on an island, so our dignity is at stake when we are dealing with various healthcare providers, other family members. There's a lot of that goes into it. So a person sitting down looking at planning, they would want to try to address substitute medical decision-making systems. It's easy when we're alert and oriented. We know what we want and what we don't want. But how do we express our values and our wishes when we're under diminished capacity? Number two, financial decision-making. How do we direct our investments? How are our investments invested, or rather directed, if we're no longer able to do that ourselves, pay our bills? And then moving into, how do we pay for this care and get the care that we need, and understand, what does that good care look like? What is, for instance, dementia-specific care? What does that really look like? If it involves, for example, Alzheimer's, So we would look at those programs of paying for care. A lot of times that's public benefits planning, understanding the role of Medicare, Medicaid, veterans benefits, all of those pieces.
Those are very wise words. And for our program, Alzheimer's Sunrise, and on Legends 100.3 FM, this is where you were really learning about the real needs of what families need to prepare. And really, it's the hardest thing to people. It keeps people just want to kick the can down the road all the time. And what's a heartbreaker for us at Alzheimer's Community Care is we get children coming in, and they found out that Dad was taking care of Mom.
Right.
Mom was really into the whole process of Alzheimer's. The kids did not know.
Yeah.
And now all of a sudden, the responsibility now, because Dad died 3 months ago, and now Mom is accusing them of stealing their money, and all kinds of upsetting situations are occurring, and they're hurt. They don't understand, and yet they have no legal. They have no legal recourse.
Right. Well, without planning, that can create a real problem or a challenge. And the very things that we as older adults worry about our dignity, our independence, our financial security, are the very things that are in jeopardy if we kind of go into denial and procrastination. It really is sort of a cruel irony that happens. However, if one sits down and really does try to have a very intellectually honest approach to addressing substitute medical and financial decision making, financing long-term care. I'm not talking about insurance. I'm talking about the custodial care issues, understanding the housing arrangements. Those are things that will help preserve that independence and autonomy.
May I add there too? There's another layer of complexity, and that is when you are choosing those surrogates. You really need to keep in mind what your wishes are. If you are very passionate about how you want things done, you need to choose the person that will do it and not have a conflict with your decision.
That's a very important point. So many people may feel like they have access to advanced directives, and that's a good thing. It really is. It was encouraged under our federal law several years ago at time of admission into any kind of a healthcare situation. It's not a requirement that you have them, but they're important. And actually, Karen, one of the most important services an advisor can provide is teaching the client how to use these documents effectively and who you are deputizing to act. We have a notion in our country, and it sounds a little like I'm talking in platitudes, but our First Amendment, our right to bodily self-determination, to make decisions, is something we in the law called substitute medical decision-making, where we are basically making the decisions mom or dad or husband or wife wanted, even if we have different sets of values. And so you want to pick someone who can honor that. If a person's a Jehovah's Witness and they don't believe in blood transfusions, but they can serve the principal, the client, and honor their wishes should they want those transfusions, then that's really the ideal path. If we don't know what a person wants, we're left with what's called best interest.
Well, in nursing and medical ethics, that's our concept of autonomy.
Yeah.
And so if that person said, I would never want to be artificially fed, choose a surrogate that's okay with that. Otherwise, they can actually negate what your wishes were.
Yeah.
Well, that leads into another whole concept about, thinking about what one child sees of what mom, especially when there's more than one child.
Right.
And if all this is not talked out, you've got a perspective of it's usually around 2 or 3 children. And you know something, and I believe what you do is prevention. And when I say prevention, the family, that patient is going through all this change. Yeah. The one thing that everybody wants is to be around that bed together as in unity. If this is not done, if these issues are not discussed, that won't happen.
Well, Mary, to not be cynical, but what is our definition of family? We have many live-alone adults who maybe they have children, maybe they don't. Maybe we're in a second or later marriage, and the kids of one spouse are worried about the financial security of the ill spouse who's not their mom or dad. You've got children that are in a better financial position and very devoted and capable, and you also have children that are in jail or have underemployment issues and substance abuse issues, and the family dynamics impact just as profoundly as the wording on that power of attorney or on that trust as well. So counseling's got to really take into equation, are you working with not only a good advisor, but are the families going to be an influence on that plan being upheld?
And you can reach us at Alzheimer's Community Care, 561-683-2700, and our website, alzcare.org, ALZCARE.org.
And if I can add to that, Karen, just sort of an advisor in the elder community, it is so important to reach out to Alzheimer's Community Care because of their sort of holistic approach. They don't just treat the patient, they do treat the caregiver and are as in their namesake, community, they are so well connected to the community. It really does take an interdisciplinary approach to manage dementia that is protracted, like you find with Alzheimer's. So a person is out trying to go home and they look like they're wandering. We need that. We need Alzheimer's community care to be that sort of clearinghouse.
Absolutely, thank you. It does take an entire community to protect these families. We can get that process started. Alzheimer's Community Care can be reached at 561-683-2700 or through info@alzcare.org, ALZCARE.org.
Just to take a little break right now, we are coming up to a big luncheon, and we'll talk more once we hear about that. Be right back. We'll hear more from Alzheimer's Sunrise.
For Alzheimer's patients and their caregivers, daily life presents many challenges. Be a giver of hope this season by attending Alzheimer's Community Care's annual Palm Beach Luncheon, February 7th at the Beach Club in Palm Beach. All proceeds from the lunch and silent auction benefit patients and caregivers in Palm Beach County. Visit alzcare.org for information and to purchase tickets.
Well, welcome back. This is Mary Barnes with Alzheimer's Sunrise, shining a light for our patients and caregivers. And we're speaking with Karen Gilbert, and she's our co-host and partner in crime here.
Partner in crime, thank you, Mary.
And we're and we have a wonderful guest in Mark Shalloway, and Shalloway, who is an elder law attorney.
Yes.
And just to get back into the swing of things that we were talking about before, talking about prevention and talking about having people remain in the community. Yeah. How do we get there?
Wants to remain in place, aging in place at home where the heart is, home sweet home, home is our castle. There are situations where you can become homebound and isolated if you don't have a spouse or kids, and it can be lonely. But no one sits across the conference room table and says, sign me up for early enrollment in a nursing home. And and I'm not attacking nursing homes. There are actually scenarios where it might create socialization. But one of the attributes of Alzheimer's community care was the recognition that people really do want to age in place. And in many scenarios, we can improve the quality of life and lower the cost of care, like our specialized adult day centers have at Alzheimer's community care, giving the spouse or the caregiver respite, and not just to go to the doctor, but maybe even have lunch or dare take a nap. But the reality is there is a cost to have home health aides coming in, or the cost of adult daycare services. And that's where, frankly, some of the public benefits planning needs to be addressed. And that would be something that people should really turn to the National Academy of Elder Law Attorneys, or abbreviated NAELA, NAELA.org. And through the accreditation of the American Bar Association, there are lawyers who are certified in the field of elder law. And that's also true, for instance, in Florida and many states, there is board certification in elder law. Much like medicine, you have doctors board certified. And that's one way the consumer can be sure that they're getting an attorney who's vetted not only with their technical expertise and experience, but ethics. They have to have high professional ethics as well.
And that's so important for that nationwide access, because a lot of, families have children that aren't here. And there's a conversation that everybody can have about having wherever the children are to get connected with that other part of the country.
That's very true. Yeah. So many of my families or my clients have adult children. They could be scattered throughout the country, whether it's Chicago, New York, or LA, and they're trying to care for an aging parent long distance, which is challenging enough if you're local.
That's right.
So that resource, again, NAELA, NAELA.org, has those board certified lawyers. Or just remember Alzheimer's. That's care.
There are so many areas of elder law that we really need to explore over time, because of the fact that it's such a big and it's so diversified, complicated, yet simple when you're able to actually put all the pieces together.
Yeah, most of our healthcare, Mary, came about in like the mid-'60s, the Great Society legislation, and people were getting aged and passed away shortly, and Social Security retirement was earlier, and now people are living longer. So what we've seen is our policymakers at the federal level and the state level looking to recognize community-based services of the sort that Alzheimer's community care provide, whether that's adult daycare, family nurse consultants, to help families navigate through the clinical issues and to act as a clearinghouse. And I would say that that's really important because when you are living with something like Alzheimer's that can span 5, 10, 15, 20 years, you need to understand your residential care settings, whether you're living at home. In the 1980s, it spawned the birth of a whole nother housing industry called assisted living. Didn't even exist in the 70s or 60s.
Right.
You know?
We spent a lot of time at Alzheimer's Community Care, and what we put on our website, and we vet a lot of the information. Families need to have authentic information.
Right.
And one thing that our board of directors, which you're a part of, and the organization itself, the professionalism that we pride ourselves on, and actually being able to establish what skilled care is with Alzheimer's.
Right, dementia-specific standards.
What is a skilled care? And what are principles that we should be following? And the advocacy of what they should have the right to ask the doctor, have the right to ask when they do go see an attorney, or with the right they have in any area. They have the right to ask those questions and get those answers. And we even put down on those questions. We even put down in helping families understand what they should hear as far as answers go. So it's a lot all to do and all to digest, and it really is, again, a complicated issue.
We can provide a lot of answers that you need and a lot of guidance. For more information, you can reach us at 561-683-2700. You can also send us questions at info@alzcare.org, and that is our website, alzcare.org. The website is full of information on upcoming events, on educational opportunities, videos for the Florida Silver Alert. There's a tremendous wealth of information through our website, and also questions for Mr. Shalloway in elder law you can send to us, and we can't possibly cover the entire scope in 30 minutes, so we may follow up based on your questions with another focus on elder law issues. From what I hear, we have more people in the United States now over 65 than we do under 16. So instead of being a pyramid in this country, with the smallest group being over 65, it's now kind of evening out to some doctors call it the rectangularization of our population. So the needs will only grow.
And I think that I've said very often that the numbers that they're quoting that families are affected, I think they're really understated. I definitely think that there is not, which makes it difficult for you also in Mark, in how to help families because of the fact that the pathology of the different diagnoses are different. So why is it important to get a good diagnosis? It almost goes hand to hand of what you're trying to do with the family to help them plan, because of the fact that it's getting more complex about understanding what the diagnoses are. So having this can't be a one-time visit.
No, but I hope
that I hope you come back and share the time with us. We didn't put you too much on the hot spot.
Yeah, as you're listening, I think my takeaway was really to emphasize the importance of reaching out to credentialed resources, and Alzheimer's Community Care is a prime example of that. When you're listening to this program, it may be hard to really scratch out notes, but one to write down. It involves the contact information, because even the references to the different professional credentialed lawyering organizations can all be disseminated by the Alzheimer's Community Care and help you get the right follow-up advice.
Well, there's been such a wealth of knowledge here, and again, we're here sharing our time and sharing the information at Legends 100.3 FM, and we're going to be here on Sunday mornings, and at 6:30, I guess that's when we, to come in, and we enjoy having you this morning, and just trying to get through the complicated arrangements, complicated issues of the elder law issue.
Mary, there was one interesting topic we were discussing even off air that I wanted to kind of bring up, because we have so many veterans who have served.
That's true.
We're losing a lot of our World War II vets, but our Korean War vets and our Vietnam vets and other younger men and women, when they face these issues, these I have found anecdotally to be individuals and families whose first impulse is to serve our country and not to request help. But many times there is an outreach to, say, for example, the Veterans Administration. And there are some very good men and women who work in that organization. However, their jurisdiction, their function is qualitatively different from working with an accredited Veterans Administration attorney.
Right.
Or at the very least, an accredited Veterans Administration or VSO organization. And so it's important, again, as a consumer, if they want to follow up with Alzheimer's community care, veterans benefits are numerous. There are different requirements, different supports, different services. Please don't rule out those possibilities. Some require a service-connected injury during wartime, but others do not. Some are benefits not only for the vet, but perhaps for a surviving unremarried widow, or even for an adult disabled child of a vet. So information is key to preserving that independence, that financial security, and working with the credentialed persons, because there are vulnerable, families out there that will fall victim to.
And the demand, yes, and the demand for that is going to get greater, because here's the issue: when you're talking World War II veterans, it was the shrapnel that was the big injury. When you're talking about the Vietnam, that was Agent Orange. Mm-hmm. What we're having is head trauma. And we're all beginning to learn from science and from research that head trauma does have an effect.
Sure.
And especially when we're seeing younger and younger patients, and also younger and younger veterans being affected.
Right.
So,
questions, comments, suggestions, and any information additional as to what we covered today, you can reach us at 561-683-2700. or at info@alzcare.org, ALZCARE.org.
I think it's great, and I'm looking forward to talking about this again in the future.
Absolutely.
But thank you so much, Mark.
Well, thank you for having me. Appreciate the opportunity.
Thank you.
Thanks for listening to Alzheimer's Sunrise, lighting the way for patients and caregivers. To learn more about the help and hope available from Alzheimer's Community Care, call 561-683-2700 or visit alzcare.org. That's ALZcare.org. Tune in next Sunday at 6:30 for another edition of Alzheimer's Sunrise, lighting the way for patients and caregivers right here on Legends 100.3.